Diabetic ketoacidosis can become life-threatening in a heartbeat. It's a critical condition that requires immediate and precise intervention to prevent severe complications or even death. Today, let's dive into the deadliest mistakes nurses make every day, and how to avoid them. These errors can be subtle but have significant impacts on patient outcomes. Mistake number 1. Delaying the insulin infusion. Insulin is the cornerstone of DKA treatment, and any delay can exacerbate the patient's condition. We all know insulin is the key to stopping ketoacidosis, but sometimes nurses wait too long to start or restart it. This delay can be due to various reasons, such as waiting for lab results or physician orders. Whether it's a delay in getting labs or verifying orders, every minute counts. The longer we wait, the more severe the acidosis becomes, making it harder to reverse. The sooner we begin that carefully titrated insulin drip, along with frequent blood glucose checks, the better our patient's outcome. Regular monitoring ensures that we can adjust the insulin dose as needed to stabilize the patient. Mistake number 2. Inadequate potassium monitoring. Potassium levels can drop rapidly during insulin therapy, leading to dangerous complications. Remember, insulin drives potassium into cells, so our patients are at high risk for hypokalemia. This can cause muscle weakness, cramps, and even life-threatening cardiac arrhythmias. Failing to replace potassium when levels drop can lead to deadly cardiac arrhythmias. It's crucial to monitor potassium levels closely and replace them proactively. Always check potassium levels every few hours and replace proactively as needed. This vigilance can prevent severe complications and ensure patient safety. Mistake number 3. Poor fluid management. Proper hydration is essential, but it must be done carefully to avoid further complications. With DKA, patients can be severely dehydrated. This dehydration needs to be corrected promptly but cautiously. But the goal is to replace fluids in a controlled way. Too fast, and you risk complications like cerebral edema. Too slow, and you prolong their acidosis and risk organ hypoperfusion. Balancing fluid replacement is a delicate task that requires constant monitoring. Always follow evidence-based protocols, measure vital signs closely, and adjust fluid rates to keep patients stable. Adhering to these protocols can make a significant difference in patient recovery. Mistake number 4. Ignoring subtle changes in mental status. Mental status changes can be an early indicator of worsening DKA or other complications. DKA patients can deteriorate quickly. Confusion, restlessness, or lethargy could signal worsening acidosis, hypoglycemia, or cerebral edema. These changes can be subtle but are critical to catch early. Don't just rely on labs. Frequent neurochecks can catch early warning signs that labs might not yet show. Regular assessments can help in timely intervention and prevent further deterioration. Mistake number 5. Stopping insulin too soon. Prematurely halting insulin can cause a rebound in ketone production. Even if blood glucose looks better, the anion gap may still be elevated. This gap is a crucial indicator of ongoing ketoacidosis. If we halt insulin before the gap closes, ketones can rebound and the patient can slip right back into acidosis. This can undo all the progress made and put the patient at risk again. So keep insulin going at a safe rate until you have clear confirmation that the gap is normal, then transition carefully to subcutaneous insulin. This ensures a smooth transition and prevents relapse. By avoiding these 5 deadly mistakes, delaying insulin, overlooking potassium, mismanaging fluids, ignoring mental status, and stopping insulin too soon, we can save lives. Each of these steps is crucial in managing DKA effectively. Let's stay vigilant, trust our protocols, and always remember, every action we take can be the difference between life and death for our patients. Our diligence and attention to detail can make all the difference.